Primary dentition stage. Hi, welcome to our series of videos on the development of occlusion from birth to adolescence. In our first video, we discussed gum pads. Now let us continue with the second stage of occlusion, the primary or deciduous dentition stage. Childhood is the most beautiful of life's seasons, and so is the development of the first set of teeth. This phase is known as the primary dentition period. The time from infancy, when the first tooth erupts at about 6 months of age, until all the primary teeth have erupted completely from approximately 3 to 6 years, marks the primary dentition period. Occlusion is established in childhood, changing throughout life, and is therefore called a dynamic interrelation between facial structures. The development of occlusion can be conditioned by several factors. The genetic factors, passed on from one generation to next. The environmental factors, like gender, ethnicity, etc. And as the occlusion is established along with the growth of other facial structures, it is also influenced by the facial muscles, positioning of the tongue, respiratory abnormality, and habits such as thumb sucking, tongue thrusting, mouth breathing, bruxism, etc. Have you ever had a glimpse of a preschooler's smile? All that you see are tiny pearls, beautifully arranged in a pattern. After watching this video, you will appreciate these smiles and patterns from a dentist's perspective. Let us begin with the characteristic features of the arrangement of primary teeth. First thing that catches your attention when you see primary occlusion are the spaces between teeth. Oops! Has the child already begun to have a malocclusion? But don't worry. These spaces, also known as diastemas, are considered normal and are an essential feature of primary occlusion. As the permanent teeth that succeed the primary are larger, these spaces are utilized by them. Spaces or diastemas are of two types. First is the physiological space, and second is the primate space. The physiological spaces are present in between all the primary teeth and play an important role in the normal development of the permanent dentition. Total space may vary from 0 to 8 mm, with an average of 4 mm in the maxillary arch and around 1 to 7 mm, with an average of 3 mm in the mandibular arch. The primate spaces in the maxilla are present mesial to the primary canine, that is, in between it and the lateral incisor. On the other hand, in the mandible, the primate space is seen distal to the primary canine, or between it and the first molar. Primate spaces are also called anthropoid or simian spaces, as they were initially found in our ancestral simian or the monkey species. Based on the presence or absence of these spaces, Baume divides the primary dental arch into two groups as follows. Type 1 is the open arch that represents the spacing in the dentition in all the stages. Type 2 is the closed arch or non-spaced dentition caused by increased tooth size or decreased arch size. The presence of a non-spaced dentition is an indicator of crowded future permanent teeth. But in some cases, the arches grow and accommodate them. Did you know spacing was first described in 1918 by Delabere? Now let's move on to the determination of occlusion, viewing them from aspects, the posterior and the anterior aspect. In posterior occlusion, the mesiodistal relationship of the distal surface of second deciduous molar in both arches determines the occlusion type. This is called the terminal plane, which is the key factor that influences the future occlusion of permanent teeth. According to Baume in 1950, primary occlusion can be classified into three types based on the terminal planes: the flush terminal plane, the mesial step, and the distal step. Let us discuss them in detail. The most commonly seen and most favorable relationship to guide the permanent molars into class 1 relationship is the flush terminal plane. In this plane, the distal surfaces of the upper and lower teeth are situated on the same vertical plane. The mesial step also guides the permanent molars into a class 1 relationship, but it may also lead to class 3 malocclusion during molar transitions. We will be discussing this aspect in our upcoming video. In this plane, the distal surface of the deciduous lower second molar is more mesial to that of the upper second molar. Finally, the distal step is an unfavorable relationship, as it guides permanent molars to a class 2 malocclusion. In this plane, the distal surface of the deciduous second mandibular molar is more distal to that of the deciduous second maxillary molar. Luckily, this terminal plane is seen in only 10% of cases. Now let's move on to the anterior aspect. When viewed anteriorly, the most evident feature one notices is the deep overbite or deep bite. This is seen as soon as the anterior teeth erupt. An overbite is a vertical relationship, the distance between the incisal edges of maxillary and mandibular incisors. The primary incisors erupt in deep overbite, which is corrected by the eruption of the posterior teeth. On examination, an average overbite in primary dentition is about 2 mm at this point. As further growth occurs, the ramus of the mandible lengthens and grows downward and forward. The incisal edges now end up in an edge-to-edge or zero overbite. This is also influenced by the physiological attrition of primary teeth, observed by age 6. Secondly, the horizontal distance between the lingual aspect of the maxillary incisors and the labial aspect of the mandibular incisors when the teeth are in centric occlusion is known as overjet. The average in primary dentition is 1 to 2 mm. When compared to permanent teeth, the primary maxillary and mandibular incisors are more vertically placed, with an angle of about 150 degrees. This reduces the overjet and increases the overbite. Finally, let us discuss the relationship between the primary canines, the most stable relationship in primary dentition. It is classified into two types. Class 1 is where the mandibular canine interdigitates in embrasure between the maxillary lateral incisor and canine. And Class 2, where the mandibular canine interdigitates distal to the embrasure. Other general features of primary occlusion are the shape of both the dental arches are half round or ovoid, the natural curvature of the occlusion or the curve of Spee seen in permanent dentition is absent here, and the cuspal interdigitation is very shallow. To summarize, the ideal features of primary teeth as described by Foster and Hamilton in the year 1969 are spacing in incisors, primate or anthropoid spaces, flush terminal plane, deep bite, and decreased overjet. Based on the characteristic features of primary dentition, let us try to differentiate the self-correcting anomalies from the malocclusions. Pop quiz. Isn't it as simple as a cakewalk? So, from now on, whenever you examine a child with primary dentition, I'm sure you will have a quick recap of this video. Oh, by the way, what is the importance of primary occlusion? It helps us to foresee what the permanent occlusion is likely to be. Evaluation of occlusion at this stage is an essential part of comprehensive oral health care. This allows clinicians to predict the influence and outcomes of abnormal occlusion, thereby encouraging parents to opt for early intervention.
Pop quiz.
We will be back again to continue with the most dynamic stage of the occlusal development, the mixed dentition stage. Hope you had fun learning with us.